We turn now to issues surrounding genetic engineering. We've already seen that the possession of genetic information presents a unique set of ethical concerns. For the most part, the involvement here was passive, since the really difficult issues centered on what to choose. The possibility of causing any genetic events was never raised. As we move forward, however, we have to determine what relevant factors are associated with genetic research. Science has been fairly successful at genetic advancements. It's now pretty commonplace to hear about cloning certain kinds of animals. There's also some hope of eradicating diseases as a result of genetic manipulation. But we are also at a point where certain decisions to go forward have to be made, depending on the moral ramifications of doing so. In many ways, research has outpaced the ethics, and people today recognize that this cannot continue. We have to be able to give a reasoned argument justifying the investigation into what we can do before we succeed at being able to do it. This is why this topic in the course is, in many people's eyes, the most important topic in medical ethics right now. We're going to look at three different areas of inquiry. Number one, the permissibility of genetic enhancement. Number two, eugenics. And three, cloning. Now, there is overlap between them all, but it's helpful to consider each in isolation. In this podcast, I will give you an idea of what to focus on in the upcoming readings on genetic enhancement. In the next podcast, I will say a few words about eugenics, and in the third, we will cover a few concepts related to cloning. There are two important distinctions at the center of the debate over genetic enhancement. First, there's a distinction between positive and negative genetic engineering, and second, the distinction between germline and somatic cell alterations. The first distinction between positive and negative genetic engineering, or what is also called enhancement and therapy, has to do with whether the desired changes were aimed at a normal level of functioning or at some point beyond normal. For example, we might hear of a company trying to come up with a genetic treatment for cystic fibrosis. The goal here is to make certain changes in the DNA of a subject, which then neutralizes the gene that causes the disease. This would be negative engineering, or therapy, since people with cystic fibrosis are thought to be disadvantaged by the disease, and the goal is to remove the disadvantage and get them up to the same level of functioning as those without CF. A second example would be engineering genes so that those having the genes would be 3 to 4 inches taller than the current average height. Presumably, people 3 inches taller than the average height have an advantage. It's better to be 6 feet tall than 5 feet 9 inches, say. But the person 5'9" is not at a disadvantage relative to other normally functioning people. Thus, the effects of the engineering are to make individuals superior in some way to the average person. This is an example of positive engineering, or enhancement, since there is no disease or disadvantaging condition being eliminated. Now, many people think that there is a clear and bright moral line dividing positive and negative engineering, with positive being morally wrong and negative being morally right. This would mean that there is something inherently wrong about positive engineering. There are some problems presented by this line of thought, however. As both Glover and Resnick point out, it's not always the case that there is a clear and bright line between positive and negative engineering. In some instances, it might not be obvious which category a particular action belongs to. And Resnick, who is looking exclusively at the distinction, questions whether there are any good arguments showing that there is anything wrong about positive engineering in itself. If there isn't, then what determines whether positive engineering is wrong is the circumstances in which a particular act occurs. But then there would be no reason to ban positive engineering outright. Glover looks at some of the arguments against positive engineering and ultimately finds that most of the arguments present cases for proceeding with caution, but not for prohibiting the practice altogether. The second distinction that gets often raised is between germline and somatic cell alterations. Germline alterations pass on to succeeding generations. If we make a change in the genome in an individual currently alive, the offspring of this individual will have the same changes in their genomes. While somatic cell alterations don't pass on to further generations in most cases. Now, you should be able to see the ethical issues that arise with germline alterations in particular, since decisions made now could have drastic consequences of multiple individuals decades later. So the welfare of these future generations must be considered in discussions of germline alterations, while receiving less attention in the context of somatic cell alterations. One objection that seems to many to be a discussion ender is that when we start trying to manipulate genes in order to make certain improvements, we are practicing eugenics. And the most infamous proponents of eugenics were the Nazis in Germany in the early 20th century. Thus, if it could be shown that genetic enhancement is a form of eugenics, we could ban it outright, since eugenics itself is immoral. But we have to ask, is eugenics itself immoral? Many people have perhaps an incomplete picture of what eugenics is. So to see whether eugenics is immoral, we have to get a clear picture of what it is. And that's what we hope to do with the 2 assigned readings on eugenics, a podcast of which I will present next.